Then these are grades of radiographic sacroillitis. As I have told, grade 0 means no sacroillitis. Grade 4 means ankylosis. Both you cannot see the joint. Grade 1 is you have a suspicious. Sacroiliac joint X-ray is a very, very difficult X-ray. You have to actually prepare the patient for the X-ray. If there is a lot of bile shadows, you cannot see anything. So actually, ideally, the patient should be asked to take this tablet, Dulcolax tablet or something, and morning after freeing everything. Actually, that is the way how it should be done, because bile shadows really interfere in the interpretation. Number 2 is then grade 1 is suspicious. There is a mild patchy sclerosis around some joint. Grade 2 is minimal. There are sclerosis, but there are some erosions. But usually, by and large, the joint space is maintained. If the joint space is narrowed down or sometimes widened, because ankylosis will cause fusion. Why there is a widening of the joint? Because of the erosion. Fat deposition will not cause widening of the joint. It will get deposited in the bone because of the erosion. So either widening, pseudo widening, that is what is called a pseudo widening, or mainly the fusion or the decrease in joint space, then you will tell it grade 3, and grade 4 is ankylosis, right?